Our disease of choice is
stroke.
There are many risk factors associated with stroke. Some unmodifiable ones are age, sex, race, and heredity. Some modifiable ones are hypertension, hyperlipidemia, smoking, diabetes, cocaine use, heavy alcohol use, obesity, and heart disease.
Since Betty is 86, has a history of hypertension, has smoked for 50 years, and her mother suffered from a stroke, she is at higher risk.
Some signs and symptoms of a stroke include weakness, so a sudden loss of strength, and or a sudden numbness in the face, arm, or leg. Trouble speaking, so a sudden difficulty speaking or understanding, or a sudden confusion. Vision problems, so sudden trouble with vision. Headache, so sudden severe and unusual headache. And dizziness, sudden loss of balance, especially with any of the above signs. Hi, Miss Betty.
Hi.
I'm Amino, your nurse working with Dr. Neuro today. Dr. Neuro will be here shortly. How are you feeling?
Not good.
No? Okay, so yes, you did have a stroke. A stroke is the sudden loss of brain function due to the disturbances of circulation of blood to the brain. Within that, there are two types. These are ischemic, which is the one that you had. It is the most common type of stroke, accounting for 80% of strokes. This is caused by the interruption of blood flow to the brain due to a blood clot. The other type of stroke is hemorrhagic. This is due to the rupture of blood vessels in the brain. The interruption of blood flow or the rupture of blood vessels causes the brain cells in the affected area to die.
Hi Betty, I'm Dr. Neuro.
Hi.
As Nurse Amino mentioned to you before, you had suffered from an ischemic stroke.
In normal homeostasis, blood is supplied to the brain because the brain needs it for oxygen, as blood carries oxygen. The oxygen is used by the brain for energy and nutrients. Primarily, the energy is used by the mitochondria in the cell to make ATP, which is used to run active transport pumps, for example, the sodium-potassium pump. Active transport pumps that are found in the cell membrane or mitochondria pumps calcium out of the cells. The active transport pumps are also made of proteins.
Glutamate is an amino acid. Amino acids are building blocks of proteins. Glutamate is an excitatory neurotransmitter that is widely distributed throughout the brain, also involved in memory and cell-to-cell communication. Glutamate is usually removed from the synapses by active reuptake transporters which require energy. The receptors involved with glutamate are NMDA and MPA. The MPA, when activated, are sodium channels, allowing sodium to come into the cell, and the NMDA is another receptor that controls channels that allow calcium to enter the cell. What happens when you suffer from an ischemic stroke is that there is a blockage of blood flow to the brain, which reduces the amount of oxygen supplied to the brain. Therefore, you have reduced amount of energy, which results in not being able to remove glutamate reuptake mechanisms, which are needed to take glutamate back into the presynaptic cell. This creates an excessive amount of glutamate in the synapses. The excessive amount of glutamate acts as a neurotoxin. The glutamate then binds onto the receptors, causing sodium channels and NMDA channels to open. Then, calcium will enter the cell with water following. This causes the cell to swell. Calcium balance in the cell is regulated by energy. The mitochondria transport mechanisms require energy to regulate calcium concentrations in their cell. Without energy, the transport mechanisms cannot run properly. With not having enough energy, calcium cannot be pumped out of the cell. The calcium diffuses in excess from ECF to ICF and cannot escape, causing the cell to become overloaded with calcium. The overload of calcium in the ICF kills the cell in two ways. These two ways are: excessive calcium damages the mitochondria, which causes the mitochondria to produce the free radical superoxide, which damages cells directly and can also cause apoptosis. Also, an excess of calcium in the ICF activates the synthesis of certain proteins. Some of these proteins promote apoptosis, while other proteins are enzymes that produce the free radical NO and other inflammatory agents.
So, Miss Betty, in summary, a stroke is a cerebral vascular accident causing loss of brain function due to disturbances of circulation of blood to the brain. As shown earlier, this affects homeostasis, the cell membrane, and proteins. Some of the risk factors associated with stroke are age, genetics, hypertension, and smoking.
So to summarize, I had an ischemic stroke, which is due to an interruption of blood flow to the brain, causing a decrease in oxygen and energy. This decrease in energy causes there to be high levels of calcium in my intracellular fluid, ultimately killing the cells?
Yes.
Strokes are medical emergencies, and knowing the signs and symptoms are important for intervention.